So, point of care everywhere. Point of care everywhere is real, it's happening, and every conversation this year, if it wasn't about wearables, it was, access to care 24/7, access to information 24/7, and this topic is extremely exciting because consumers are being able to connect not only to their physicians, but be able to connect to themselves. So we think it's a really important topic, and I brought to you a fantastic moderator who will introduce the rest of the panelists, but I want to introduce Dr. Joseph Kvedar, founder and director for the Center for Connected Health. And for those of you that might have missed it earlier this year, and you can all read all the bios in the book, but we are talking mottos this year, and so his motto is, "Great patience is required to see real innovation flourish." It's all yours.
Thanks, Jill. Well, welcome to Point of Care Everywhere. This is a special honor for me to moderate this panel because really almost 20 years ago it was the vision that got me excited about the space. And I have to confess, at that time, I really had no dream I'd be moderating a panel at the Consumer Electronics Show ever on this topic. So clearly we've come a long way. On the other hand, point of care is not everywhere right now. And that's really one of the things we want to delve into in our time with you today is where are we and where are we going and how fast are we going to get there? Clearly the technology's there. There are some perhaps other barriers. And I've got 4 really talented people with 4 very interesting points of view here with me to talk about this, and I'll introduce them in a minute. I do think that we're on to a roll with point of care everywhere, and I think it's for 3 reasons really. What's different now? Because if I was thinking about it 20 years ago, I promise you I had people that I looked up to then that were, in my mind, pioneers, so this is not really a new idea. And the 3 things in my mind, the first is the health insurance exchanges, and we've talked about that earlier today, but that is such a powerful force to engage consumers in the conversation around healthcare. It almost doesn't matter so much to me that it's about insurance. It's just getting them more to think about healthcare, what it costs, how they're involved, the choices they make. That's going to really help. It's going to help this whole industry because connected health was made for that kind of a mindset. The second is the other flip side. So two of these things I owe to the government. The second is new payment models for providers, shared risk, shared savings, accountable care, all of that stuff. And I promise you, it is making a difference. Massachusetts is an enormous market for this where I am, and we're seeing real change in the way physicians think about delivering care, and a lot of opening of their minds to the idea that they can deliver care everywhere, and it might be a good idea for both the patient and for them and for their bottom line. So new payment models is the second, and the third is everything that this show represents, which is the familiarity of our consumers and patients with these technologies. And I have to pay special homage to Skyping with grandchildren. It's done a wonderful thing for us because it's given all of these people that we used to say will never adopt technology, and I've got plenty of stories from our own group in, say, heart failure telemonitoring, carting technologies into someone's home and having them on their iPad. So it's happening. It's happening. As I said, it's not there yet, but we'll get there, and we're going to talk about it. Now, from the point of view of the Center for Connected Health, everything we do is point of care everywhere. And if I took the time to tell you about everything we're doing, I wouldn't give these talented people any time at the podium. But I thought I would try to intersect the Venn diagrams of our world of work as an innovation group in Boston at Partners Healthcare, Harvard Teaching Hospitals, and what might be interesting at a Consumer Electronics Show. And I came up with 2 things that I'll share quickly with you, then introduce the panelists, and they're each going to take some time to talk to you as well. So the first is a concept at this point. This is quite new. Part of the reason I'm sharing it with you is because I'm looking for feedback. It's interesting. There's a lot of power here, but it's raw and new. And it's the idea that we might be able to make health addictive. What do I mean by that? Well, it comes from the idea that every one of you, in this room I'm sure, I was sitting next to an individual who was working 2 smartphones the whole morning. Everybody's addicted to their mobile phones. We're checking them constantly. By some studies, 150 times a day. By contrast, it's hard for me and my team and the doctors and nurses we work with to get patients to do healthy behaviors once a day. So what is it about the addictivity of mobile phones, and can we somehow start to slip health messages in there that engage people? And I think there's real power here. So it, again, is the beginning, and I'm just going to share some framework that we're developing. We have projects going on in a lot of these areas, not all, and we're, at this point, is the framework right? What are the thoughts about how to get this done? So very quickly, 3 strategies. Make it about life, that is to say, don't preach to me about sickness or even actually health, but what do I want to accomplish in my life? Because we all want to be happy, we all want to be full of energy, we all want to get things done. Make it about life. Make it personal, and there's been a lot of talk already about personalization, so I won't repeat that. Personalization is really the currency of today's marketplace in terms of advertising, and I think we can make it the same in health. So making it personal is really important. And then, of course, using social. Again, lots of talk about that in this room and others at this meeting, so I won't belabor that. But those are 3 important strategies. In terms of the tactics, subliminal messaging, and what I mean by that is simply meet you where you are. What is it that I can message you about that is contextually relevant and fits into your life and doesn't feel obtrusive, but motivates you to be healthier? Unpredictable rewards. This is a fabulous tool to increase people's interest, and part of the reason you all check your mobile phones 150 times a day is because you're not sure what's there when you check. And then finally, the sentinel effect, which just means if you know you're being watched, you're going to behave differently. We can employ that. That's a really big reason that a lot of our programs work, because patients tell us they know their doctor's watching them in these connected health programs. So more to come on this. You can read about it on my blog, and again, feedback is welcome. The second is wellocracy, which is really an effort our center's taking to bring a different group of people into the arena of self-tracking for health, not the fitness buffs or the quantified selfers, and really not that 5% of people that that are so sick that we're motivated as accountable care organizations to monitor them, but those 90% in the middle, a lot of opportunity there. Again, I don't have time to go over a lot of it. I can talk to you about it after. You can read about it on the website, wellocracy.com. And again, love to get feedback on this, because we're searching for an audience, and I'm not sure we found it yet. So we're eager to hear from you about how to make this better as well. So that's a couple quick brief anecdotes from the Center for Connected Health. Lots more on our website. This is all of our contact information, how to get hold of me, how to read about us. And I'm going to go on now and introduce panelists briefly and have them share with you what they're up to in the context of point of care everywhere. So first, we're going to hear from Walter de Brouwer. Walter is, as many of you know, needs no introduction. He has credentials as a futurist, as a thought leader, but he's coming to us today in his capacity as the founder and CEO of Scanadu, a really interesting device company in the connected health space. To his left is Laura Mitchell, who is EVP of Business Development at GrandCare, another pioneer. GrandCare Technologies, another pioneer in the space of telehealth as well. So 2 interesting companies there. And to Laura's left is Nersi Nazari from Vital Connect, who will tell us about what they're up to and how it relates to point of care everywhere. And then, because we need a dose of reality, we had to invite a health plan to the table, and a very esteemed one at that, UnitedHealth, Yasmine Winkler, who's the Chief Marketing, Product, and Innovation Officer. That's a lot of jobs, so we want to hear from Yasmine how she gets all that to work. And the context, so important context of a leading health plan like United around this concept of virtual care. So without further ado, each of our panelists in succession is going to tell you for a few minutes about what they're up to, and then we'll have some Q&A with the group. Walter.
So, yes, actually I thought I was just sitting in a panel, but apparently I have to say something. So my company, Scanadu, started in Silicon Valley in 2011. It was our dream and our mission to make a medical device very much like the tricorder that was part of my youth, and so that this medical device would be for consumers, that it would be medical, that means going through the complete FDA tract, and that that device would also be able to connect people with their health, but also connect with each other and give each other recommendations. So for us, it was consumer, medical, so FDA, consumer, medical, and mobile. So in March, now, in 2 months from now, we are shipping our first devices to the Indiegogo backers. So we had 8,800 Indiegogo supporters who are waiting for these devices. And together, they are going to do a crowdsourced usability study for as a pre-study of the FDA file, while Scripps is doing the clinical study. And altogether, in Q3, this is going to the agency asking for certification. Because we believe that as consumers, it is our right to make and to have our medical data, to store and retain our medical data, but also we have the right to accurate data. So this device will take over, or let's say, whatever you find in an emergency room, you will find in this device. It is the vital signs. It's where you end up when something happens to you in a clinic. You know, you enter at the emergency room. Just suppose it's not the ICU. You know, there will need to be a bit more invasive. So the emergency room basically does your vital signs. That's your diastolic and systolic blood pressure with a slash, then your SpO2, your respiratory rate, and your temperature, of course, and your heart rate, you know, your ECG monitors. So normally this is all around you. This happened to my family in 2005. We were coming in with a trauma, one of our kids. We stayed in that hospital almost for a year. And you don't know anything about what's going on around you. And you may be at a highly educated level. You may be good in data analytics, but then you realize you've been kept out of something, you know. And so that's how we actually envisaged that device. And we are making more and more disposables onto that device to eventually coming to a complete medical experience in the privacy of your home.
Please, Laura.
Hi, I'm Laura Mitchell. I'm the VP of Business Development for GrandCare Systems. And just a little bit about our background is GrandCare has been on the market since 2006. We actually started innovating in 2005, building the technology. And I think Dr. Kvedar made a really great point about it's about living. And that's sort of what our mantra has been from the get-go, is if we make it about life, if we make it about socializing, if we make it about living a better life, people will want to be healthier, and they will be healthier if they're happier, less isolated. Isolation and loneliness leading to depression, always not a good thing. Generally, some bad health decisions as well. So clearly, we've got this increasing aging population. I don't think you can really talk about the rising cost of healthcare without addressing the aging population, because the amount of money that goes into acute and post-acute care is primarily, with the cost of healthcare rising, is primarily with the rising aging population. And it's not just here, it's a global global issue. So what we do at GrandCare is we have applications for the private home. We originally designed the product to be for the aging population. But recently, in the last couple years, we've had a large focus on the post-acute side of things. Of course, with the Affordable Care Act, it makes for a good backdrop for all of us in this industry because it's finally incentivizing the hospitals to not want that patient to come back into their overpriced hotel. So so what we do is we combine all sorts of different technologies into one comprehensive platform. That's really our biggest value add, is that we are the platform, we're the software providers, and we integrate existing technology. So activity of daily living, did someone get out of bed? Are they using the restroom too frequently, which could lead to someone to make several assumptions based on that. Medication management, one of the leading drivers to assisted living and pre-hospitalization. Digital health, so monitoring vitals and biometrics. Home automation, very simple things. Temperature control. I'm from Wisconsin, so we actually ended up having to drive here because our flights got canceled. So this is me 31 hours in the car later. Home automation, thank you. Home automation can be temperature control, but also, if someone gets out of bed, let's turn on that light and guide them to the bathroom. A simple cognitive assist of where they're going, as well as, mitigate a potential fall. Socialization, this is one of the biggest points that GrandCare is concerned about, is the fact that, like we said, we're all tethered to our cell phones, and it doesn't seem right that we would cut someone off just because they're aging and may not want to use the same platforms we're using, that we would cut them off from this entire social experience. So we bring that to them in a very easy, comprehensive, intuitive 17-inch touchscreen that's easy to touch, easy to use. And also one-touch video chat via Skype and other video chat applications, picture sharing, multimedia sharing, reminding them to take their medication. So we also provide a source of information while making it fun. And of course, the most important thing for this panel is the self-care management. We encourage them to be proactive about their own vitals, about their own self-care, chronic disease management. If they leave the hospital with a stroke, they should want to not go back to the hospital, but they should also be armed with information so that they don't have to go back to the hospital. They shouldn't be expected to remember all of these 37 things they need to change about their lives in the 15 minutes that they spent leaving the hospital. So it should be a constant reminder. It should be, the discharge instructions should be on there, as well as videos about their new diagnosis, maybe diet plans, nutritional information, exercise plans, and of course, the family care coordination. So everyone, even the daughter in California, can be involved in mom's care, post-acute care. So that's a little bit more about what we're doing, and I think
Hand it over to Nersi. Okay.
you might have to go through a few slides there.
Okay. Thank you very much. We are a company that concentrates on making biosensors, something very small that looks like a Band-Aid. And what we're trying to do is to have more and more vital signs in a very small package that can be worn all the time, or some of the time, or when your doctor tells you to do so, and so forth. We inherently, we sort of intuitively know that something this small and connected could be very good for healthcare industry and individuals, and also even before somebody is sick as a part of his or her health management. So rather than trying to tell the story, we actually made a little video that I'd like to show you. And this is really not a propaganda for our company. You can take our name out and put some of our other companies who are doing the same thing, that how this thing can be useful on everyday's life. So if I can manage this. Okay, do we have audio?
Things smaller, faster, more mobile, and more personalized. VitalConnect is bringing these attributes to healthcare. The VitalConnect all-in-one biosensor, together with your healthcare services and applications, has the potential to provide an unparalleled view into health, disease, and wellness. Healthcare is a scarce resource, and with a growing and aging population, we're seeing greater demand than ever. The good news is that scarcity forces us to be smarter and more efficient in how we care for patients. And that won't just mean more availability and lower costs. It will mean better outcomes for patients and families. Vital Connect provides the platform that will allow us to know more, know sooner, and respond faster. Vital Connect's real-time clinical-grade biometric measurements allow you to create innovative health monitoring solutions for hospital, home, and everywhere in between. Our real-time data analytics can detect changes in biometric measurements, whether sudden or subtle. Configurable thresholds allow for automatic notifications to caregivers or emergency services. According to a recent study, remote patient monitoring can reduce hospital readmissions by up to 62%. Long-term continuous monitoring provides comprehensive data that allows healthcare professionals to act preventatively. Whether it means monitoring chronic conditions, aiding in recovery from an illness, or simply helping us stay connected to the people we love, truly personalized healthcare is here. Vital Connect.
And then this is essentially a graphic of the device that I just showed you. And if I can hit the play button on this one also. So essentially, on this first generation device, we keep track of heart rate, respiration, and skin temperature. And also we have ECG, as you see on the screen. We have a drive measure for the stress, which we are going through clinical studies to prove that that's effective. And also, we have a measure of calorie and daily activities every day. And if I could go to the last slide. And hit the play, please. And again, on this mission that we have to have more measurements and making them smaller, we think we can make the electronics smaller and make this thing a little bit even less, maybe 5 or 6 grams. And then we also adding blood pressure and blood oxygen, plus all the other things that we had on the previous slide. And we think that this can really make a difference, like the sort of the video suggested. So that's sort of a summary of what we're trying to do and what we think that this technology can be helpful for patients or parents or loved ones, and obviously for physicians. Thank you.
Okay, so I think you're gonna hear some common themes. I'm not sure that I'm the reality check person, by the way, back at the ranch. So normally the innovation person is the one you would attribute that to. But we know that healthcare is really complicated, and trying to navigate the healthcare delivery system is probably one of the biggest challenges that consumers, patients, members, but physicians, providers also face. And we're trying to do 3 things. You're going to hear some of what Joe also talked about. Making it simple. It is incredibly complex. Making it personal, because, hey, if you get me, I'm more willing to engage and probably do some of the things that you're thinking would be good for me to do. And also making it about accessing care, right place, right time, and making sure that people really understand, okay, this is because I'm short, right? Okay. Making sure that people understand what they can have access to, because at least in what we do every day, folks don't always actually have a good understanding of the things that are afforded them through their benefits, but also just how they access care. And what we're doing is we're doing a lot of experimentation. So a lot of what you heard today, we love to partner with companies like this that actually offer a lot of these innovations. But we ourselves experiment. So we do it through adjacencies, things that are already available. So think about texting. We have a program called Baby Blocks. That's an experiment that we have right now for expectant moms. And it's about texting them to give them reminders about all of their appointments. And as they do that, they have the ability to earn different kinds of incentives that are going to be important for them and their baby. or an app like Health for Me, which all of our members have access to, that give them a mobile opportunity to actually get their digital ID card if they forgot it back at home, or their college-age student doesn't have their ID card and they need it, or being able to actually access the providers that are available to them, or a convenience care clinic if they have a semi-urgent situation and want to be able to visit one, or to understand the cost of a treatment. All of those things are available through that app. Or something like Now Clinic, which is very pertinent to today's conversation with regards to being able to have 24/7 access to a provider online, and being able to do that in a way that allows you to have a communication at your convenience when you would like to actually be able to do that. But those things we don't do just all by ourselves. We do that with a lot of other folks. But the main thing that we've really been trying to address within our organization, and for all of the types of consumers and constituencies that we serve, is really by dealing with it and addressing it from a human-centered design perspective. So we created a studio several years ago, which is powered by design artists that are all about understanding the human condition in people's homes, in providers' offices, in the settings in which they access care, and how they interface with the healthcare delivery system. And we believe that that really differentiates what we can bring to the market and to all of the people that we interact with and that we serve, because it is about outside-in thinking. It isn't about thinking within just a corporate environment within four walls, but it is really about bringing the outside world in and really thinking about the consumer and meeting them in the way that they want to be met. And we believe that that can actually make a very big difference. Thank you.
All right, guys, so now it's time for the fun part or the tough part, depending on how you think of it, because we're really going to spend some time talking about what I alluded to in the very beginning, which is why isn't this more of a reality? And I have a few questions, and then we'll have plenty of time for audience input. So be thinking about what you might want to ask this rather esteemed, diverse group of pioneers in this area. I'm going to start with you, Yasmine, because so many people, when we talk about barriers, we'll talk about payment models. And I'm not going to ask you why UnitedHealth does or doesn't reimburse for telehealth, because I think that's the wrong question. But I would love to get your perspective as someone who's innovating or in charge of innovation on behalf of the company, how much legs you think that risk sharing with provider organizations has, and if you have experience that's either similar to ours in Massachusetts or contrary, ours being that the more risk is on the table, the more open providers become to virtual care. So two questions. One, do you think this is going to be a trend that we're going to see take hold, this idea of risk sharing? And do you see it opening the door for these kinds of applications?
So I would say that definitely we see that as a trend in terms of risk sharing, and I think it also is about performance-based care and reimbursement. So we won't go down too much of a rabbit hole there, but it is about being able to earn the reimbursement as well by being able to operate at a very high quality level. And that is definitely very much part of our contracting model and how we've been working with providers throughout the nation. I think that the virtual care aspect of it, actually today we're in 21 states for telehealth, and I think you're right, that more risk sharing that there is on the table, the more people are willing to actually embrace it. I will say that 3 or 4 years ago when we were first talking about telehealth, providers really felt that it was a threat to their practices, and they weren't really excited about the idea of doing a virtual visit and that somebody might actually take their patient, or it wasn't seen as an expansion of their practice. But I think, before the end of last year, I went to see a very large system in Florida and was really excited and astounded to see their telehealth lab, where they themselves had built an entire telehealth capability that was giving them the ability to do consultations remotely internationally, as well as within the state, and also for their patients to be able to have access to their physicians within their system. I asked them, I said, so what was kind of the breakthrough? And it was just this reality that there was this incredible opportunity for them that wasn't about somebody imposing something on them, but them actually embracing technology that could really change the game in terms of how to bring their expertise to others.
Yeah, accountable care or risk sharing, whatever word you like, does really, I think, a few things in that regard. The most obvious is it takes away the burden of running people through the office to make a living. But there are others. The second is that, as I can tell you this as an organization that's, I think we have 4,000 specialists at Partners Healthcare of our 7,000 doctors. And so encouraging the folks that refer us patients and being more connected to them becomes a big deal in an accountable care setting. And connected health, telehealth allows you to do that. And the third is patient loyalty. The last thing you want if you're an accountable care organization is to have a patient jump ship, because it costs you more money. And these tools allow you to connect with patients in a way that's fundamentally different than just, I'll see you in 3 months at Thursday afternoon at 3. So all three of those, I think, are big opportunities for virtual care in the coming times. And I'm glad to hear you say that you think that risk sharing is alive and well, because I really do believe that's going to drive a lot of this. So I'm going to turn to you, Laura. What if your company was a pioneer? You've been at it now, I guess I can't count well, but 7 years it sounds like. If you had a choice of a magic wand, what would you change to move your business forward faster? A couple things.
Well, I think that it's been a really exciting time in the last year, so I can't say how long we've all been sitting and waiting for sort of the herd to start to move in this industry. I guess I would wish for, a lot of the things that people ask about is sort of reimbursement, things like that. I would advise that people don't wait for that to happen, right? Because I think otherwise the technology will be, replaced with something else by that point, which is, I have other interesting opinions on the reimbursement thing. I think that it's going to be reimbursed for outcomes versus for the actual devices and things like that, because otherwise we'll have that sort of scooter fiasco happen again. But that said, I would wish for obviously reimbursement and $1 million personally.
I brought my checkbook.
Right, good. That's why I'm on this panel. I also would wish for providers to have a different view of this as a whole. I think that there's a lot of healthcare providers, in-home care providers, long-term care providers that we're still trying to convince that we are not a competitor to them. And the other thing is that some of the medical providers, it's a new way of delivering care. It doesn't mean that we don't need that expertise. We still need someone to sort of operate. We're sort of the baby monitor, but we're not the mom. So we need somebody to operate that system that actually knows something. If we can provide the daughter with the information that dad gained 5 pounds in 2 days, that's great. But not if she doesn't know what to do with that. So I think that, getting rid of that noise for the doctors, which is what the concern is, right? They're concerned all of a sudden they're going to get 50,000 emails a day about John's, blood pressure and how many times he used the bathroom. Well, that's not really interesting information. But if we can eliminate that noise with technologies like ours and just provide them with meaningful data about that person. So I guess it would be a little bit of the attitude shift, as well as the hospital sort of asking us, the medical providers, saying, well, who's going to pay for that? Is GrandCare going to fund this entire, we're at this huge healthcare facility, and to me, it's got to be more of them thinking about it like, who's going to pay for that MRI, machine in our, and it's like, well, everybody's going to pay for that. When I go into the doctor's office, I'm not using that, but I'm still paying for it. So that's the attitude, I think, that needs to shift a little bit in this industry.
Walter and Nersi, because you're both in the hardware device space, I'm going to ask a question that I'd love to have both of you opine on. And it has to do a bit with your business model. There's at least a conventional wisdom that it's hard to make money on hardware, that you need services or an ecosystem, and I guess it's a two-part question. So that's part one, is how are you dealing with that challenge? Again, we'll ask both of you. And the second is that I'm willing to bet, and you can correct me if I'm wrong, but I'm willing to bet that when you both had the respective visions for your companies, there wasn't a lot going on. And now 300 companies in digital health downstairs, lots and lots of gizmos. I'd like to ask each one of you to tell us how you're going to differentiate yourself above all that noise. So, Nersi, why don't you go first? Two-part question.
Well, you're absolutely right that when we started the company, as far as how do we make a market or have a success in business was an issue, and we started talking to a number of verticals in healthcare that this may be useful to them. And it's one of those things that after we talk to enough people, we actually realize that if we specialize in cardiology or weight loss or what have you, we really don't have that expertise. And our business model has actually changed to what we call a low-touch partnership. So people who actually provide the service to the end patients is not Vital Connect. We sell this product to them, and we have all the software APIs, and they write them for their platforms. And we have partners that are very small companies for health and wellness to the multinational medical device companies that they think this additional component would be useful to them.
So is it like a white label type strategy?
It could be white label or not. That depends on each engagement.
Okay. But you're really you're viewing yourself as part of the supply chain.
Yes.
Fascinating.
Yeah, our goal is to make the very accurate and small biosensors, not to be a medical service provider.
Got it. So you're just really focused on the interesting. And Walter, what's your reaction to those two questions?
So, well, the first off, I agree with you that so we have chosen the the more difficult path of making an ecosystem. And if you want to make an ecosystem for consumers, and by the way, there are probably 300 companies downstairs in health, but how many are consumer and how many are not avoiding FDA? There's, I think, I can only think of like 2, 3, The making that ecosystem means that you have to build the hardware, because without the hardware, you cannot have structured input. If you have to extract your information from medical records or from somebody else's hardware, it's undoable. You have to make for the consumer, and that's why we're servicing, actually, we are surveying consumers all over America, asking them, like, what do they want? What part of the diagnostic experience of a hospital would they be willing to take at home? Because, and that's, point of care everywhere. The point of care market is $15 billion globally. Now, if that point of care is going to move to the homes, which is the decentralization policy of all governments in the world, so then that means that this portfolio is going to be replaced, displaced, or duplicated. Because all this technology in point of care, which was mostly concerned with strips, with rapid markers, that is all now part of the experience that we can do with our smartphones. We just made a urine analysis, which goes to FDA in the next quarter. Well, that urine analysis is, again, actually strips, which you put on panels. But now, instead of having a black box in a lab, you have to make it in different light-insensitive corridors, because the consumer is going to do it in every sort of light corridor. So, new questions, new problems, but $15 billion of point of care, plus $4.8 billion of home health devices, plus another $5 billion of between hospital and the consumer at home. That's a $25 billion market. And it's a market that will not exist by avoiding FDA.
Right. Got that. So the second question is, how do you rise above the noise of all the other sensors?
Well, we have done the commitment from the beginning to go FDA.
Okay. So that's a big differentiator for you.
Yeah, because it means like so many tractabilities that you have to build in a company. Yeah. You have to be innovative, but at the same time, you have to, this mountain of documents,
Right.
you know, you know, I can show you slides that, you know, like, you know,
Please.
it's for most, it's a very difficult thing now for a startup if you are not actually versed in lifecycle management of hardware or lifecycle management of software, plus intractability of FDA and regulatory. If you have to do that all at once, well, you're in for a very interesting clusterfuck. You know?
Sure. Okay. Let's liven up the afternoon. I have one quick question again for you, Yasmine, and then I'm going to open it up. So again, get the mics ready and get your questions ready. We do really, we divide our work at the center in this, as I said, this is all of what we do, but into 4 areas: virtual follow-up visits or virtual visits, home monitoring, traditional telehealth, which really means specialty outreach and the like. And then the last one we call, it's a bit of a catch-all, we call patient engagement. It's like the OB texting that you were talking about, and initiatives like that are really mobile health initiatives that don't necessarily involve a sensor, but are designed to engage people. And from your perspective, what I was hoping you would share, again, as the innovation lead for your company, if you see any one of those 4 categories getting more traction in the coming year, is there one that's really poised to go big?
Well, I think we've been thinking about it in 3 different ways. So one is telehealth, kind of the way that we've been talking about it. And some of the limitations there are regulatory, because there are some states that don't actually acknowledge telehealth visits in the way that we would think.
Yeah.
And so that is one of the things that we still have to overcome in some of the states. The other is really kind of mHealth oriented. So we have something called Lifelens, which is a smartphone-enabled capability, which creates encrypted images remotely, so that then those can actually be conveyed to the physician, and the physician can then see those things and can make decisions about patients that they actually aren't seeing directly, but that have been captured on those images, so that it's all HIPAA compliant. And so that, we think there's a lot happening around that space as well.
Yeah.
And then, you know, we are thinking more and more about the patient engagement aspect of it, right? So how do you use texting? How do you use, you know, I don't know if it's going to get to Snapchat and Instagram, but, you know, that there is definitely that need for a continuous kind of conversation between a patient and their provider, and that enabling that in a way where the messaging can be something that is very specific to something that needs to happen, that is part of, you know, whether it's the glucometer aspect of it, or if it's a well baby visit or whatever that might be, that's also something that very much is part of the engagement experience.
Great.
So I don't know that there's one. I think that we're on the cusp of a lot of these things right now, and I think it's because of the adjacencies. We use a lot of this technology and a lot of the day-to-day things that we do for a lot of other things,
Right.
so why not in health? And I
Right.
think that's really what we're pushing, is that we believe that people would really accept a lot of those types of activities if you just present it to them in the way that they do everything else, instead of trying to make it something very separate and clinically oriented, which
Right.
frankly is not fun.
No.
You know, that's not really
No,
fun,
I
right? So
completely agree.
it's really about how do you, for those things that they're used to, whether it's the phone or it's your cell phone, or, you know, think of our kids, and you talked about Skyping with grandchildren. This is part of what we do for all other aspects of our life. Why not in health?
Let's get a couple of questions from the audience. I don't know if we can turn the lights up because I can't see a thing, but so I'm going to have to pay attention to the people in the front here. This gentleman here, please. Mic coming. The mic's coming.
Hi, my name's James Garnier. I work in consumer diagnostics. It's kind of a general question. As we remove the healthcare professional... Hello?
Yes.
Okay. Sorry, I work in consumer diagnostics, and it's a sort of general question to you all. As we remove the healthcare professional from the user, the patient, and the advancements with diagnostics in the home, we'll get to a point where you're going to have issues of delivering results or data to a patient. Maybe, you know, hypothetically you tell them they have cancer or something like that, and the healthcare professional isn't there. They're getting that on their phone. Do you see what's your opinion on these sort of issues? As things become more enabled,
Sure.
that buffer isn't there for the professional.
I'll take a crack at that. So the question really has to do with the role of having certain interactions with your provider be face-to-face, and it's appropriate. And the example that was used was getting the news that you had a diagnosis of cancer. And it's interesting because I use that example a lot when I'm speaking as well. And what I say to that is that it's our obligation, and that's everyone here, to not screw that up. To not build systems that screw that up. I mean, think of all the amazing things that we've done with technology. We can relieve healthcare providers of the stupid things that we don't need them for, but we should preserve the things that are special about having a healthcare provider, and I'm sure we can do that. I don't know if you guys have thoughts about that, but that should not be a problem that we can't solve.
And I think it would just be about enhancing the attributes of the healthcare provider. So clearly, if it encourages rural visits, and I just think of this frigid, weather that's going on in my wonderful home state and the Midwest and the Northeast, and I think about all of those seniors that aren't getting the help that they need, or home care providers, or they aren't able to go to clinics. It's negative 20 degrees out. So, should that mean that they don't have any access to care during that? I think that it's really a great point of, that doesn't mean we have to be stupid about it. I mean, clearly, we're not going to text someone that they have cancer. We would call them. No, I'm just kidding.
Our kids are all breaking up over text, so maybe someday. But
Post-it note, right?
Next question. Do we have another? Someone here? Yeah, this gentleman.
Thank you. Mr. Nazari and Mr. Brouwer, the number one cause of death in this country is preventable heart disease. And given that, what precedents exist that show a relationship between personalized health data and positive lifestyle changes? And what is the result?
It's in all our surveys, so you see what most people have at home now is a thermometer. That's the extent of our medical our medical tools. Actually, thermometer is the most sold device, but it is not the biggest installed base. The biggest installed base is a blood cuff, a blood pressure cuff. Now, people stop using it after 3 to 4 times because of number one reason, they threw away the box and they don't know anymore how to do it. Or number 2 reason is they get confused by standing up, lying down, that their blood pressure is different. And they think when I'm going to the doctor, it's always the same. It's always too high. So they stop doing it. Now, I think the epidemic that we had in the 20th century and in the 19th century in our hospitals, fever, for which we have made a thermometer, and it's now so widespread and now so frictionless. The epidemic of the 21st century is certainly cardiovascular. And the blood pressure, if we can make the blood pressure so frictionless that people can monitor it themselves. But now the problem is, according to me, that we need a new conversation with doctors as consumers and as patients. And that new conversation, the API bridge between the doctor and the consumer, is FDA. So we have to talk about the same data. We have to talk about the same accuracy. We have to show the doctor that this is FDA clear device that we have been using, and I think we have to prove to the agency that there is a sort of emancipation going on for consumers, that we are able to take our blood pressure at home, that we know how to do it, that there are devices that, because basically a thermometer, there's not so many holes you can stick it in where you don't get the right temperature, So we have to go to the same frictionlessness with blood pressure. And this is also something, a case we have to prove.
Did you have other thoughts, Nersi?
But I just add the thought that if we can have these measurements more often, there are advantages that we really haven't been studied yet. One of the stories that one of our doctor advisors tells me is that, and he's a cardiologist, that when you go and make a blood pressure measurement, sometimes people are nervous to go to see the doctor. And doctor sees just that one measurement. and maybe gives you medicine, and then you come back and say, okay, maybe that was not the right thing to do. And the doctor is at no fault. What we're trying to do is to give more data, and as Walter said, accurate FDA-approved, clinically tried measurements, so better care can be prescribed by the doctor.
All right, well, with that, give everyone a hand, please.